Hello, everyone. My name is Dr. Colleen Denny. I'm an obstetrician gynecologist, and I work in Manhattan in New York City, taking care of pregnant patients, well woman health, families, and reproductive health generally. I'm here today to talk to you about COVID vaccines, particularly around questions related to pregnancy and fertility. So just to give an overview of some of the big issues regarding the COVID vaccine, the truth is that COVID-19 infection is still a big deal. And unfortunately, in the United States, it's still killing thousands of people every day. The good thing is that we now have COVID vaccines in our fight against COVID infection. And the general idea of COVID vaccines is that having a vaccine protects people against getting a COVID infection at all. And if you are unlucky enough to get COVID after you've had a vaccine, it protects you against having a serious version of COVID infection. And generally, that's how vaccines work. They teach our bodies to recognize and to fight off a disease without us having to catch the full-blown version of that disease. There are vaccines for measles, for the flu, for chickenpox. And most of us at this point in our adult lives, we've had dozens of vaccines to protect us against these kind of preventable infections. So when COVID vaccines started coming out in late last year, in December 2020, people were excited. But also, as with any new medical treatment or intervention, we also had a lot of questions, both our patients and doctors like me. And for an obstetrician gynecologist like me, who takes care of pregnant people or people who want to have pregnancies in the future, an important question was there anything we should know about this new COVID vaccine when giving it to people who wanted to be fertile? And to answer that question, we had to ask sort of two questions. There's two parts to human fertility. The first part is getting pregnant in the first place, and then the second part is having a successful, healthy pregnancy. So I'm going to focus on that second question first, having a successful, healthy pregnancy and how that relates to the COVID vaccine. And the question here is, does the COVID vaccine cause pregnancy complications? And to be honest, this now turns out to be a pretty easy answer. And that answer is no. The vaccine does not cause pregnancy complications, even if you've had it before your pregnancy or you get it during your pregnancy. When the vaccine first came out last year, showing that it worked well to prevent COVID and that it was safe, those big studies initially didn't try to include pregnant patients. They were only using non-pregnant adults. So we didn't know the answer to that question. Now, a year later, we have information from using the vaccine in hundreds of thousands of pregnant women. There's about 172,000, if you're actually looking at the CDC website, of people who've had the vaccine during a pregnancy. And so we now know that the vaccine is safe during pregnancy. It doesn't cause birth defects. It doesn't cause premature birth. It doesn't cause miscarriage. All those things we worry about, obviously as patients, but also for me, taking care of pregnant patients. And that information was so strong that in July of this year, 2021, the national group of all OB-GYNs and midwives in the country actually said we should offer and strongly recommend it to all of our pregnant patients. So what about if you're pregnant and you haven't had a vaccine? What's the downside, or what are the risks of avoiding the vaccine? And unfortunately, it seems that if you're pregnant and you get COVID, your outcomes are worse than if you were not pregnant and had a COVID infection. The consequences of COVID infection are a lot more serious. If you have COVID when you're pregnant, you're more likely to be admitted to the ICU. You're more likely to need a ventilator or a breathing machine. And unfortunately, you're more likely to die. Unfortunately, COVID cases have been up and down in the United States, and it's really hard to predict over the course of a 9-month pregnancy what your COVID risk is going to be during that whole pregnancy. So, COVID vaccines are very safe for pregnant people. They don't cause pregnancy complications. That part of the question was pretty easy. But then let's go back to that first part of the question. Does the COVID vaccine make it harder to get pregnant in the first place? So to answer that question, we have to think a little bit about all the systems that have to work well to have a conception, to begin a pregnancy. Getting pregnant requires working eggs, a working set of fallopian tubes and uterus on the part of the woman, and you also need sperm from the male partner. It's a pretty complicated system, but luckily the COVID vaccines don't affect any of these organs or any of these cells. How do we know that? Well, one, we made the vaccine. We know how it works. It teaches the immune system how to fight off COVID. It doesn't affect the reproductive system that would create a conception or a pregnancy at all. And then two, just looking at the numbers, we now have thousands of people in the United States who've had a COVID vaccine in the past and now are pregnant or their partners are pregnant. And because of this, again, that national group of all OB-GYNs in the country, all the midwives in the country, they recommend vaccines for anyone who's trying to get pregnant. Again, to help them later have a healthy, COVID-free pregnancy. So something my patients often ask me is, if you're telling me the vaccine is so safe and it doesn't affect my fertility, why have I heard some people or read things online saying the COVID vaccine makes people infertile? It's a good question. It's sort of hard to trace where this kind of scary rumor comes from. And obviously it is scary to hear, especially for people who want to have a pregnancy. I think there are two main sources of this incorrect information. One is that people are confusing the COVID vaccine, which is a shot, with injectable forms of birth control. They're both shots, but they're totally different medicines. The injectable form of birth control is not a vaccine. The other thought is that there was some very early research on the vaccine that they thought that the vaccine might affect a protein in human placentas. A placenta is the organ that supports the baby and gives nutrition during pregnancy. Like so many other worries that we had about COVID, if you remember when we were all washing our groceries, that turns out this isn't true. It doesn't affect health. The COVID vaccine does not affect human placentas and doesn't cause any bad effects. But the truth is, like all rumors about healthcare, even if it's not true, if we know it's not true, it's really hard to stop a rumor that sounds scary. So my key takeaway points for people who are pregnant or wish to become pregnant and are building their families is that COVID vaccines are very safe at baseline for all adult people, and they make it much less likely that you'll get sick or die from COVID. COVID vaccines don't make it less likely that you'll be able to get pregnant when you want to be. And COVID vaccines don't cause problems for pregnant patients during their pregnancy, even if they've had them before the pregnancy or they get them actually during their pregnancy. On the other hand, the risks are real. Pregnant patients who do get true COVID infections while they're pregnant, they get much sicker than people who aren't pregnant. So my real message to people who are building their families and desiring pregnancy, if you or someone you love wants to have a healthy baby in the future, the most important thing you can do is to avoid getting COVID while you're pregnant. And getting vaccinated is one of the best tools that we have to do that. I work in New York, so I always say to my patients, all New Yorkers can walk in for free COVID vaccines. I have this website here, the Vaccine Finder, that helps people find something that's convenient for them. You don't need to have insurance to have a COVID vaccine. You don't need to have proof of citizenship to get a COVID vaccine. So in working with the group and patients that I've had, I've also created a couple questions that people have after hearing this talk, and I'd like to share some answers. One is that I have patients tell me, I already had a COVID vaccine. Should I get a booster COVID vaccine during my pregnancy? And that answer is yes. If you're a person who had a regular COVID vaccine either 2 or 6 months ago, depending on which shot you get, you should get a booster. And that is because pregnant women, like we discussed, they're in a group of high risk. They're at high risk of serious consequences for COVID infections, so boosters are a good idea for them. Patients also ask, they say, I already had real COVID. I had the true infection. Should I get a COVID vaccine? My answer to that is yes also. Even if you've already had COVID already, we don't really know how long that immunity, that protection is going to last. On the other hand, COVID vaccines have been shown to directly decrease the chances of getting sick and of having serious consequences of that illness. Patients often ask me, can a COVID vaccine alter my DNA or my baby's DNA when I'm pregnant? That answer is no. That's not how the vaccine works. The vaccine trains your immune system to recognize and fight off COVID infections, but it doesn't change your DNA in any way. And if you're pregnant, it doesn't change the DNA of your fetus. Will the vaccine make me feel sick? Some people do feel a little bit, I think the word is lousy, after they've had a vaccine. Some people don't really have much of a reaction at all, except besides their arm hurting a little bit, but some people do feel a little tired and achy a day after they had the vaccine, maybe 24 hours or so. And some people can have a low-grade fever. If I have a low fever after my vaccine and I'm pregnant, should I do anything special? And I say, it's important to know that most people don't have fever after they have the vaccine, but some people do. If you do, it's a good idea to take Tylenol after you notice the fever. Tylenol is a very safe medicine for pregnant people. We give it to people all the time for various illnesses, injuries, pain, complaints, and it's very safe. And it will help bring down the fever, and it will also help with any tired or achy feelings that you have after the vaccination. Patients also ask about antibody tests. They might say that their antibody test from their blood says that they still have antibodies from either getting a vaccine in the past or because they truly had the COVID infection. And they wonder if they should still get a vaccine or a booster if they're eligible. My answer to that is yes, you should get the vaccine or a booster if you're eligible. High antibody levels show that your body was exposed either to the virus in the past or to the vaccine in the past if you had a vaccine. But they don't tell us how that level will protect you against getting COVID or how long the immunity is going to last. And again, COVID vaccines are really tied to good outcomes. They have been shown to directly decrease the chance of getting sick and having serious consequences because of that infection. Patients often ask, when should I get the COVID vaccine during my pregnancy? Is it best to get it the first trimester, second trimester, any particular month? And I say the best time to get a COVID vaccine is now. There's no reason to wait until later in pregnancy. The vaccine is safe, really safe, in all months of pregnancy. And the sooner you're vaccinated, the sooner you, and honestly your baby, are protected against serious illness from that COVID infection. And then my last question is for patients who are considering giving birth outside of a hospital, trying for a home birth. And they ask, well, if I won't be in the hospital, do I need a COVID vaccine? And I say, yes, this COVID vaccine is still recommended. 9 months of pregnancy means that you have 9 months of being exposed to the world. There are many people who might be sick or still not vaccinated. And the main risk of getting COVID during your pregnancy isn't in the hospital. After all, everybody in the hospital has a vaccine and is wearing a mask, but in the months leading up to the birth when you can't control your exposure as much. And for that reason, a vaccine can give you an extra layer of protection to avoid getting a COVID infection during your pregnancy. So thank you very much. Please reach out to NYLPI with any questions, and we'd love to hear more about you, and we hope that you're able to get a vaccine and keep you and your family safe.